Why is an ESR blood test important for lymphoma? Have you ever wondered why doctors order an erythrocyte sedimentation rate blood test for lymphoma patients? This test plays a significant role in understanding the disease. The erythrocyte sedimentation rate, or ESR, measures how quickly red blood cells settle in a tube of blood over 1 hour. A higher ESR indicates inflammation in the body, which is common in lymphoma due to the growth of cancerous lymphocytes and the immune response that follows. One key reason the ESR test is important for lymphoma is that it serves as a supportive diagnostic marker. While it cannot confirm lymphoma on its own, significantly elevated ESR levels are often found in lymphoma patients. For instance, an ESR value above approximately 35.5 millimeters per hour has shown over 70% sensitivity and specificity in distinguishing lymphoma from other conditions. This makes it a useful test that can raise suspicion and guide further diagnostic procedures. Another important aspect of the ESR test is its ability to indicate disease activity and severity. Higher ESR values are often associated with more advanced stages of lymphoma and the presence of systemic symptoms like fever, night sweats, and weight loss. In cases of diffuse large B-cell lymphoma, elevated ESR levels correlate with worse overall survival and progression-free survival, highlighting its role as an independent prognostic factor. The ESR test also plays a crucial role in monitoring treatment response and recurrence. By tracking changes in ESR levels during and after treatment, healthcare providers can assess how well a patient is responding to therapy. An increase in ESR may provide an early indication of disease recurrence or progression, allowing for timely intervention. Additionally, the ESR test is often part of a broader diagnostic and monitoring panel. It is typically evaluated alongside other blood tests such as lactate dehydrogenase, complete blood count, and C-reactive protein. When elevated ESR is combined with elevated lactate dehydrogenase and systemic symptoms, it can strongly suggest lymphoma, prompting further investigation. However, it is important to note that the ESR test has its limitations. It is a nonspecific test and can be elevated in many other inflammatory, infectious, and malignant conditions, as well as due to factors like age and pregnancy. It cannot replace tissue biopsy or imaging for a definitive diagnosis of lymphoma, and a normal ESR does not exclude the possibility of lymphoma. In summary, the ESR blood test is an important tool in the management of lymphoma. It provides a simple and inexpensive marker of inflammation that aids in diagnosis, assesses disease severity and prognosis, and helps monitor treatment response. However, it should always be interpreted in conjunction with clinical findings and other diagnostic tests. If you have concerns about lymphoma or any symptoms, it is essential to consult with a healthcare professional for personalized advice and care.